I'm Norgrove J. I'm a pediatric orthopedic surgeon, and I live and work in Victoria, British Columbia, Canada. I spent 6 years, however, working in Uganda between 1996 and 2002, establishing a children's orthopedic rehabilitation project there, of which Clubfoot work was a very big part of, and which really ushered in the Uganda Clubfoot project that has achieved some recognition around the world.
Yeah, great.
When Shafiq Parani, my colleague, visited me and we put together this program back there. Now I have a practice in Canada. I do certainly see children with club feet, but by far the largest volume of children that I see with club feet are actually overseas. I didn't know about it when I was working there because I felt very isolated at that time, before internet connectivity and so on. And Shafiq Parani came and visited me and told me about it, and it was new to him as well. He had visited Dr. Ponseti very early on, 1998 or 1999, when it was first becoming known. And he said, why don't we try this in Africa? And we had such large numbers of children with club feet, I mean vast numbers. And I was doing lots of surgery on mainly children that were neglected club feet, that were older. We realized we had to try and pick up the babies early, develop an education and awareness program. And we certainly didn't have surgeons. I mean, I was the only children's orthopedic surgeon in a country of 30 million people. We found that we absolutely had to have a technique that was non-operative. We didn't have operating rooms, we didn't have surgeons, and so we jumped on the Ponseti technique early and began to train non-doctors how to do it. Found that it could be very successfully done, and we had large clinics. The clinic that we were dealing with there was seeing 40 babies every week. Oh, wow. So it didn't take long to gather a pretty big experience and to realize this technique not only worked, but we got better results than we'd seen as surgeons, Dr. Parani and I, in our surgical practice, well-trained pediatric orthopedic surgeons. Right. So we became passionate about this pretty early, and very early on started visiting Dr. Ponseti here, coming to Iowa, taking in the courses. And Dr. Ponseti kindly included us on the faculty, because I think he realized here are people who now had experience with several hundred babies treated at a time when in the United States and Canada we were beginning to see 20, 30, 40 cases treated in a few practices. Right. So, and we had all this experience training people. So we became involved in the training seminars here in Iowa and in Baltimore, and then subsequently in Manchester and so on. And that sort of put Uganda and the work we'd done on the map. Here is a technique that not only is revolutionizing our work here in the United States and Europe and the developed countries, but we can apply it to underdeveloped countries and say, this is the best, this is gold standard. It's Absolutely. Not yet another lower technology or lower standard of care just because of the difficulties of these countries, but no, this is the best.